Oh yeah, this is James Maddock. You can call me Maddock. I'm a remedial massage therapist. I'm a myotherapist in training, and this time in this video, I'm going to talk just briefly about the therapeutic relationship as it relates to remedial massage. Um, what the therapeutic relationship is the professional relationship that the therapist has with their client or patient, and the boundaries that go with that. So we have scope of practice, which means that we are trained and educated to do soft tissue therapy. We're not allowed, or it's unethical, you should say, to go outside of that scope of practice. We should have at least, most therapists, all therapists really should have a professional association to which they're a member. I'm a member of Massage and Myotherapy Australia. It's the largest massage therapist and myotherapist association in the country. And they have a code of ethics and standards of practice, which they have published and advertised. And as a member, I am bound by contract to those documents. What that means in practice is that when a client comes in, when you come and sit in front of me, it's your time, really, and you can talk about whatever you like. If you've had something really heavy happening in your life, that's all fine. I'm more than willing to listen. It's your time, and whatever you need to feel better and relax into your session, into your massage, it's totally up to you. The boundary comes in that I am not qualified as a counselor. I don't have any psychology or psychiatry qualifications. So I can listen and I can reflect back what I'm hearing and make sure that I'm understanding what you're saying, but I'm not qualified to offer any advice or guidance. So that's one example of the boundaries of the therapeutic relationship for remedial massage therapists. Another boundary is we're not meant to do anything that we're not trained for. So what that really means is something that we don't have any kind of qualification or certification in is not really something we should be doing. Now, there are some therapists who will do things like, and this is totally legitimate, I think, if they've thought about it and they've developed themselves. So they might do sound therapy, for example, using singing bowls, tuning forks, drums, binaural beat patterns, these sorts of things. You don't necessarily need a qualification in those things, but you still need to know what you're doing. And you also, as part of the therapeutic relationship, you need to seek the consent, the informed consent of the client or patient, which means that before you do it, you explain what it is and why you are choosing to use that particular technique or therapy or modality with you, the client or patient. And you have to understand why that is. You have to understand what it is and why it is for it to be an ethical intervention or thing to do for you. So these are basically the basics of the therapeutic relationship. These are things that I hold very precious to me in my practice. They're very important to me because I think that if you're not an ethical practitioner, then it's borderline abusive for your clients to be receiving treatments that you're either not qualified for or don't know what you're really doing, or that you as the client or patient don't understand. So this is one of the reasons that I really go out of my way to explain what it is that I'm doing, to explain what it is that is happening in your body, and if necessary, to explain how your body works to you. It's quite an amazing piece of machinery that we have walking around with us. It's a gift. It's a privilege to have a human body, and the self-awareness and consciousness of that body. And so part of my responsibility, I think, is to actually bring your mind's awareness back into your body and to reconnect the relationship that you have with your body. And I do that by strengthening the therapeutic relationship. These things go hand in hand. So that's my thoughts and feelings around the therapeutic relationship. Just a passing thought that I had that I thought that I would share with you. My name again is James Maddock. I'm a remedial massage therapist in Carlton North at a place called the Urban Alchemist on Nicholson Street at the moment. Hopefully I will either hear from you soon or talk to you again soon on these videos. Look out for me coming up soon. Remember that I've been trying to think of a way to sign off for these videos, and this is what I came up with. Tell me what you think. The most important thing in this world and the world that is coming is kindness. It's not money, it's not power, it's not influence, it's kindness. Remember that. Till next time.